On Bridge Street is sponsored by Aging Advocates CNY.
As our loved ones age gracefully, keeping them safe is paramount.
And that is where an Aging in Place assessment from Aging Advocates can help. Here to tell us more, we have Melissa Murphy and Kristen Matthews joining us here in studio. Great to see you both. And we've known Melissa here for a while. Yeah. Kristen, you are new to the program, new to Aging Advocates. Tell us a little bit about yourself.
I'm a physical therapist by trade. I've been working as such for 34 years now, and I've really had a passion working with seniors, so just kind of evolving into this role has just been a perfect fit, especially in my life when I need a little more flexibility with my mother, who's also a senior. So it's given me a great experience to be prepared for that.
That's great. So Melissa, why is Kristen a good fit for Aging Advocates?
Well, as we've been growing, we get a lot of calls of people trying to learn how can they remain in their home independently longer, right? Nobody wants to leave their home, we know that. So I wanted to bring in another angle of expertise to help with that in-home safety / aging in place assessment. So I knew a physical therapist would be an ideal skill set to bring. And when I met Kristen, she actually reached out to us first. And when I met with her, I knew she was the perfect fit. Like she said about her background as a physical therapist and going through the navigating the aging field with her own mother, she brought the perfect skill set as well as an amazing, warm personality. And don't let the smile fool you though. She's a bulldog and she advocates, she advocates when it's necessary to get our clients the appropriate care.
Great combination.
Yes.
You mentioned Aging in Place, that assessment. What does that look like?
Yeah. So sometimes you have just the physical therapy or the nursing aspect for these in-home safety assessments, but when it's from the aging life care perspective, it's looking at the whole picture. So it really is finding those risk factors that may lead to somebody falling, ending up in the hospital, and then unable to come back home. So Kristen, do you want to give some examples of the things that you look for in that assessment?
Yeah, it can be very, very simple. The primary ones that anyone can look for, that we certainly look for, are hazards that could cause a trip or a fall. That's the most common thing that happens at home. So simple things just like making sure that pathways are clear in all of the rooms, especially if someone's using an assistive device like a walker, making sure that there's adequate lighting in all of the rooms that the individual uses in the home, light switches that are handy when you walk into the room, stairs also well lit, and also grab bars or handrails are really important, especially on all stairs, and then where necessary, particularly in the bathroom where a lot of falls will occur.
Kristen, why is this important? Why should people do this?
Most falls occur in the home, and a lot of them can be prevented. So doing just very simple measures can really prevent a lot of those.
Go ahead, what were you going to say, Melissa?
I was going to say, in addition to those fall risks, looking at their diet, their management of their medications, and things that can contribute as the whole person and their risk factors. Even being isolated in the home, depression, all of these things kind of, once they combine, the risk goes up.
As part of the assessment, I mean, do you look at whether or not this person should be living by themselves or, living in, like the Nottingham, for instance?
Absolutely. So we like to weigh the pros and cons. If somebody wants to stay home, what are the things that we can implement to reduce their risk? Or maybe the home's just, it's not going to be accessible at any point, no matter what. Or the social isolation. Maybe we could bring in some caregivers, but that's not going to give them the quality of life that we see they could benefit from in a community. So that is absolutely part of that assessment, is again looking at the whole picture of the individual and seeing what is going to be the best case scenario to meet their needs.
Real quick, is the assessment covered by insurance?
Well, with us, it's not, because it's a part of our service that we normally do as far as the general intake assessment. But if somebody happened to be working with a home care agency, a lot of folks do have that in place. Any physical therapist or occupational therapist, that would be part of their assessment. That would be a really smart way to start things, yeah.
Ladies, thanks so much for coming on. We do appreciate it. Really important stuff. And again, this segment has been sponsored by Aging Advocates CNY.